All right, we are live. Hello, everyone.
GM. Hello.
Let's just make sure we are streaming all right. Yeah, everything is looking good. Okay, cool. Welcome. Thank you guys all for joining us today. Super excited to have SpineDAO on the line. SpineDAO is a new BioDAO being incubated in the network. They are accelerating spine care research and products for both consumers and surgeons. SpineDAO is being led by some of the top spinal surgeons and researchers in the world, some of whom we have with us today. And SpineDAO will be among the first DAOs to go through BIO's new launchpad. So we're thrilled to introduce them here to the community, learn about the potential for DeSci to disrupt global spine care. So let's start with intros. If each of you could give us some background on yourself and what led you down the DeSci rabbit hole before starting with the SpineDAO crew. James, if you, my co-host here, want to introduce yourself, that'd be great.
Y'all should already know me by now, but for those who don't, I'm James. I've got a background in chemistry and material sciences. I lead all the science here that we do at Bio. And it's been just incredible to get to meet the SpineDAO folks. I remember when Vincent and Virgin took a last-minute flight to San Francisco to meet myself and Paul in person, and that changed the course of history for us both. So really exciting to see the initiative and to get to deep dive into the science with the team. And so I'm really excited for them to get to share with the rest of you all what kind of science it is that they're working on.
Thank you, James. Hello, everybody. So I'm Vincent. I'm gonna talk, and then you will comment, guys. We can do that.
Maybe we can give a little bit of the background, and then you can just go for it. Yes.
Yeah, sure. So I'm not a top spine surgeon in the world, Nate. I'm just a general spine surgeon in the countryside of Bordeaux, France, in Périgueux, the land of duck and truffles. And yeah, I had this luck to meet top surgeon and top researcher in the world that you can see like just above me. So I'm a general spine surgeon, and I love to build bridges between people. And I think that SpineDAO is the right vehicle, and Bio is also a super engine to do that. And I go along the magnificent Virginie Lafage and the wonderful Basel Diebo. Maybe you can introduce yourself, sweeties.
Sure. Hello, everybody. So I'm Virginie. By background, I'm a mechanical engineer with a PhD in biomechanics, and that's basically where I started to get involved into like trying to understand the spine and trying to understand like the result of a surgery. I still have my strong French accent, but I'm in the US now for the past like 20 years, where I'm doing like clinical research. So I was quite fortunate like to work with Frank Schwab. He's a spine surgeon, like specialized in complex surgery. And over the past 20 years, like we've been deep down into traditional science. We create a multidisciplinary team of clinician, engineer, student, PhD student. We're quite involved in research-wise with some study group. So this gave us like quite some visibility, and also involved with some startup. But really, like my full-time job is like a research in spine and meeting some of my friends here, like to spend some time with me.
Nice. Thank you, everybody. It's very exciting to be here with you. My name is Basel Diebo. I got my medical degree from Syria, Aleppo, about 20 years ago, almost now. Then I immigrated to the US, where I met a lot of great friends like Vincent and Virginie in New York. We spent many, many years looking at the spine in all directions and all dimensions and all topics. I did research at multiple institutions in New York City, and then I trained as an orthopedic surgeon. And then I became a spine surgeon here at Brown University in Providence, Rhode Island. I also spend a lot of time. I'm a fully practicing spine surgeon. I spend a lot of time also doing research, and the goal of all of us is how to provide better care to our patients worldwide in every way possible. So I'm very excited to be here.
All right. So now let's have like a pitch or like 15-minute presentation before a question. What you think, guys? It seems legit. So if I can do that, yes.
Yeah, we can see your slides.
Okay, perfect. So, okay. So it began. I'm sorry, I lost the signal.
You're still good.
You're still good.
Yeah, can you hear me?
Yeah,
Oh, yeah.
absolutely.
Yeah.
Okay, and if I play with the slide, is good.
Yeah. Let me. Okay, there you go.
We could, yep,
Yeah,
you just transitioned.
We can see the problem slide
Okay.
now.
Okay, perfect. So yeah, it's been like 15 years that we are practicing surgery, spine surgery now, and we were able to identify with our group of surgeons like some super basic problem. We like nowadays we are dealing with robotics and digital twins and stuff, but you have to know that there are like basic inefficiencies that are real burden in our practice. Like the first inefficiency that we suffer from is the fact that we see 90% of non-surgical candidates in our offices, and it's wasting office time. First of all, for the patient, because the patient is like he's waiting like 3 months or 4 months to have an answer to his solution, and then he come to the office. In 90% of the case, we are like, yeah, we can explain the disease, but we are like, we don't have any solution because we are surgeons. So it's a huge burden for the patient. For the surgeon, it's also a burden because we are trained to be surgeon. And when it comes to see like 100 patients per week at the office to operate on 10, it's a huge burden also for the surgeon because you have only like 7 to 8 minutes to take care of the patient at the office, and it's totally inefficient. I love in real life link and bonds with the patient, and 7-8 minutes is not possible. It's also a burden for insurance and payers because basically they pay for inappropriate care. They pay for a surgeon saying to a patient that, well, what you have is not surgical. So this is the first inefficiency. The second inefficiency is, woohoo, I've got my surgical patient during my office hour. What do I do? What kind of strategy that I can propose? You also have to know that there is no consensus, basically, on surgical strategy for a given patient. And in our group, I will present also the other star and people that are part of our group. When you have a WhatsApp group, and when we present a case, you have a spectrum from the microscopic decompression using endoscopy to the full reconstruction of the lumbosacral area using rods and gauge, super aggressive for a given patient. So there is no consensus. And you also have to know that it's a very aggressive surgery. We have like up to 50-60% complication rates, but also 30% revision rates at 2-year follow-up. So we need to build a consensus on our strategy. The last inefficiency is I love patients, but I don't want to see well-being patients post-operatively in my office. I want to see them at the market. You have to come to Périgueux. There is a delicious market. Yeah, I love to see them at the pool, at the library. But if they are well-being after surgery, they're taking a slot in my office, and they're taking a slot of people who is suffering. So we also imaginated a technology using AI and Internet of Things to have tailor-made follow-up, post-operative tailor-made program, etc. So that's the 3 first problems that we want to address. And to address them, we want to put researchers, practitioners, but also patients all together globally. And I think that DeSci and DAOs are like the adequate and efficient system to perform that, because of like the blockchain immutability, transparency, incentive. You can incentivize patient, researcher, and also practitioner to share data, to labelize data, to analyze, to create predictive modeling, and all that are our project. And you can check on our website. These projects are quite detailed. Like to go over like quite quickly, Filter project is a project that aims to provide a solution for the patient when he takes his appointment to say from his data through a chatbot, well, what you have looks like something surgical. We will take an appointment with the appropriate surgeon within 5 to 7 days. Or, well, what you have doesn't look like a surgical case, so we can propose another appropriate practitioner to solve your problem. But if you want to see the surgeon anyway, it won't be in 5 to 7 days. It will be like in 2 months. Just to hierarchize and to select the patient and to give them like a fast track to the appropriate care that can be surgical, non-surgical, pain management, etc. The Decide project, super play on word, is from me. Is the surgical assistant to suggest the best strategy in terms of outcome and mitigate the risk for a given patient. Tracker is a follow-up patient using Internet of Things. We also have an imaging integration because another huge burden is the fact that all the images are spread in silos, and it's a nightmare to have the image when you're not in your center. And from this research project, so we want to make product, but we want also to produce analysis and scientific analysis. And we also identify another problem in DeSci, and it's widely known. Like it's been like several months that people are talking about this traditional science bottlenecks problem. So we want to create the DSpine journal, Decentralized Science for Spine Care journal in open access that could be able to publish the analysis from our project, but other project for other people in the DAO or outside. And Virginie will talk about that. And also my favorite project, my Madeleine de Proust, is Spine Archive. It's just to build the world's largest repository of spine science, from like the first description of spine disease, from like Hippocrates, Galien, Leonardo da Vinci, etc., to the latest insights using AI agent doing bibliography for us. So that's the overview of our project. You can check on the website. But I want to emphasize on human bones for my part today. So you met Virginie and Basel, but you also have to meet Guillaume and Joseph. They are part of the core team, super good friends since like 10 years, and I can give you some insight of my own narrative. So yeah, in 2013, I came in New York City in Virginie's lab, and I met Basel. So you have to know that the first job that Virginie gave to us is to find an apartment, because Basel was sleeping on Virginie's couch. So we did this. We went on Craigslist and we found an apartment in Brooklyn, and that was the beginning of like a superhuman adventure. I mean, imagine having those research fellows from all over the world, US, France, having some Japanese guy, Brazilian guy coming as a fellow for a few weeks, having this intelligence without any border at the same place. It was just crazy, and it just blew my mind. And so it was between 13 and 14. And then in 2021, with Guillaume and Joseph, we created the Spine Research Community, which is a group of 70 plus spine surgeons, neurosurgeon and orthopedic surgeon in France. And it's just about camaraderie, convivialité, like being together, being able to show our surgical case, and being able also to talk about all our failure. Because spine surgery is 30% revision rate, it's 50 to 60% complication rate, and it's a huge psychological burden for the surgeon. when the patient doesn't meet his expectation, or when the patient experience neurologic deficit after surgery, you have to deal with it. And I personally think that it has to be mandatory to stand together with this kind of issue. And the human bonds are super important in this perspective. So yeah, let's create. We created human bonds. We want to like scale up globally in order to have like an appropriate data set, because when you create strong human bonds, you're able to share your data, even your complication rate or your revision rate. And from this global data set, we would be able to perform predictive models that will be super useful for patient and practitioner. So this was our SpineTech event in London. Also on our YouTube, you can check the live streams, like 5 hours of live streams, super cool, super sexy. And yeah, SpineDAO is a non-profit association. So I wanted to show that we are like a tennis club. And it is Jose Nuno that used this metaphor. Jose is a bio lawyer that helped us to create the non-profit association. And yeah, we are the Spine Club. And either you are a patient, a practitioner, a medtech, insurance, hospital, you want to join the Spine Club, then join the Spine Club. It's a non-profit association. And we did like huge partnership. So we are super proud to announce our partnership with Data Lake. We will take care of the consent form and the data storage in their silo. GDPR ready, and they are working on HIPAA. You can see also Wojciech with me. We will also release an interview with Wojciech Sirowski, Data Lake CEO, and me. Super nice guy, super classy, and it comes from a French guy, so it's something. We are also super proud to partner with the French Academy of Surgery with Hubert Joannet and Guillaume Pourchet. And this partnership cannot go without Nassim Daouche from Preprint. So basically, what we want to do is to build the largest repository in spine science, and we will digitize the undigitized using optical characterization recognition, and be able to store like a Alexandrie library, but without the fire, a virtual library, providing, for example, like the first paragraph on the discovery of spondylolisthesis, you will have the first paragraph from Herbinio 1726. But shout out to Nassim, because he's doing a lot of work, and we will communicate on this. And then last but not least, and this is the proof that we met in person in real life with James and with Paul. So we had the pleasure with Virginie to come to SciCon 2024, and we saw like a lot of boiling intelligence with Balash, Clarisse D'Aiello, Rohan, shout out to them, Tristan also. It was a super nice afternoon. Thank you also, Julia Logo, for the organization. And I think that now we partner, the bonds are quite tight with Bio. So let's go. Let's have this campaign for the Token Genesis event. And let's go. Kowabunga. I think we're good.
That was an amazing presentation.
I can continue to talk.
No. So I've got a bunch of questions that I want to ask, but I think I'll also want to hear from Basel and from Virginie as well to kind of hear, what their journeys have been. I think for people that are not inside the surgical space, that aren't that don't know the first thing about spine surgery, this might seem a little like, okay, like these guys, clearly they have some expertise here, clearly something's going on. But maybe you could talk about like what even is sort of the opportunity or the need for spine surgery. The only time someone thinks about spine surgery is like if they think about their grandfather who's really old and his back hurts. Maybe then is this actually very popular? Is it common? Do people need spine surgery? Just give us some understanding about the market and the science of it all.
Bassel, do you want to take that?
Yeah, for sure. Thanks, Vincent, for presenting the DAO. spine surgery or spine disease is extremely common. In the last data look, we dug deep about a couple weeks ago. We noticed that the percentage of patients on Earth that have a spine condition is more than those with heart conditions and kidney conditions. So you're talking about upward of 15 to 16% of the planet have some form of a spine disease. And if if you want to simplify all this, what's happening here is that humans maxed out on presenting solutions to spine patients. And the only way we move forward, and I will borrow Elon's description here, he said the best way to equalize with robots is to be superhumans. And there's no way we become superhumans without super solutions. With Virginie, we have done a lot of work with a huge, big network of spine surgeons and scientists around the world. And then the maximum we get to is like a few thousand points of data. And if you want to answer questions using decentralized science or blockchain or AI or machine learning, there's no way you get an accurate generalizable solution for a patient in Africa or Europe or the Middle East or Asia or the US if you have this amount of data. So what we want really here is to make the planet smaller, but collect a massive amount of data to fix specific problems we identified throughout the last 2 decades. And those problems, Vincent went over them briefly. A lot of inefficiencies in finding a physician, a lot of inefficiencies in actually getting the knowledge about the disease. So if I wake up in the morning, my back hurt, and I go to Google stuff, I could find things that are inaccurate, that are directly the wrong way. It's that simple. And then if I want to find a provider, I'm not sure where to go. So I go to talk to my, for example, primary care physician. And then they tell me, well, it seems like you have to see X. And then I go to X, they tell me, well, you're in the wrong place. I think you have to see Z. So you can, now we build frustration from the patient. And as Vincent mentioned, the payers, for example, is like, why are we paying like a few $100s every time this individual sees an inappropriate practitioner? And then the patients might run into a person who will recommend a wrong intervention because they actually weren't the person to see. So you can picture how every step of the way there's a problem. And even as Vincent mentioned, if I am a surgeon, I'm looking at a scoliosis kid, 17 years old, I really want to have the perfect answer to their disease. What type of constructs, what type of treatment, what long of a fusion, what type of implants to put in, what's their bone quality, muscle quality. That's where digital twins come in, and you cannot build a digital twin from a 2,000 people data. So, and then after they finish their treatment, how are they doing? Vincent, mentioned that briefly. Well, we don't track them dynamically. We don't know how they do in the library. We don't know how they do in the market. We just know how they do when they come to see us. So there's no dynamic a tracker for our patients. So every step of the way, there's a problem. And I personally nor the hundreds of surgeons that we know or scientists know how to fix it. We need data. We need decentralized data because we're done with a specific company say, well, we have our own solution. Why don't you make the patient pay for it? Well, we have our own stuff, but it really doesn't work in Europe, but it works on American patients. So we want solutions to patients worldwide, and that's why we're here.
Yeah, and right now SpineDAO is heavily focused on the spine surgery because that's our expertise. But we are onboarding an additional physician because not every single spine problem needs a surgery. The majority of them do not need surgery, and so at one point we're gonna have enough people and enough data to really also address the non-surgical part. We're gonna start right now. Yes, is it a surgical candidate or not? But later on, we're gonna also include pain management, physical therapy, really to talk about spine care overall and not just spine surgery. It will take time, but that's our objective.
Of course. And I think I'd love to understand maybe what are the gaps in the current ecosystem or the traditional way of doing things that even allows SpineDAO to exist? Because Basel, you explained, right now, if you want to get this kind of knowledge, you Google around, maybe your PCP has some idea, probably not. Can you tell us more about, what the gaps in the system look like and why you all are even able to create a DAO around spine health to begin with?
Yeah, I'm gonna I'm gonna give Virginie this answer because the gaps are really related to data. They're not related to human skills. They're not related to human desire to get better or provide better treatment. They're not related to patients not seeking the care they want. It's related to data. It's just this simple word. So I think Virginie is the best person actually in the world to answer this question.
Yeah, and I think what is quite interesting is that the data exists. It's not like we're starting from scratch, but it does exist in a very convoluted way, and also in silo. So if you take like the academic world, like we have access to data. We develop like some predictive model. You name it. But then, like the biggest problem that we're facing is that those findings or those solutions, they're not available at the point of care. So, it's nice, you go on a podium, you give a presentation, everybody clap at you, you're very proud about your work, like you end up publishing like your story, and basically you tell them like, oh, I developed an algorithm and it works. So it's purely an academic exercise. The other solution will be like some of the company that we actually work with on a daily basis. They also have access to data and they develop some predictive model, but those are only available within their ecosystem. And because like the technical skill, the scientific knowledge, and the data exist, we want to make sure that everybody is talking together. And I think that's going to be like the difference with SpineDAO versus what currently exists, is to make sure that whatever we develop is available at the point of care or is available with whoever wants to use it. So it's not necessarily, we need to create like some new data. We need to come up with some new way of doing algorithm. It's just like, let's work together. Let's also bring like some new skill, like new talent. Because in our academic world, like we work with a few statisticians, maybe a few engineers, a fair amount of clinicians, and those clinicians, they have like clinical backgrounds. They don't have like research or product development background. I mean, I love them, but that's not their primary skill. And there is so much like expertise in the world, like where there is like Web3 algorithm developer, like marketing. And that's really like the story of SpineDAO. Let's put those people together. Let's also put the patient at the center of the project, because sometimes we develop solution, we develop research project, and we're like, oh, this is gonna help our patient, but maybe that's not what they want. And so that's gonna be like the main difference in comparison to whatever exists right now.
Yeah, and I want to add something very important that Virginie finished with is the patient. If you look at the science today, the patient is often out of the equation, whether with ownership of data, whether with involvement in science, and basically we have I'm going to mention Elon a lot because I respect him. I think he's one of the most brilliant individuals. There's a Department of Governmental Efficiency, and I think there should be a Department of Scientific Inefficiency, because in order to, we call it DOEs. So if you think about it, in order to collect a 400 patient data, you have to go through so much red tape to obtain approvals, to obtain which are all necessary, but they are just so convoluted. So in DAO, in SpineDAO, it will allow us to come to the patient and say, listen, if you want to be part of this, then you can obviously sign the appropriate forms, and we're trying to go through this in multiple continents now. But if you want to be part of this data contribution or solution creation, you can, and you can contribute with your data, whether it's a trackers that you submit your before and after improvements, or it's just your demographics, or the way you feel, or your X-rays, MRIs, CT scans. If every single patient, if we get to a point where, just imagine 16% of the planet have a spine disease, if we go back to this point and just 1% contribute to the data through the DAO, then we will have extreme possibilities to come up with solutions. And no one person owns it. It will be the decentralized science, the government of the people. So that's what I like about it. And that's the opportunity.
Exactly, and you also have to know that for our philosophy is the data, the patient owns the data exclusively. The data is not for the industry. The data is not for the surgeon property. The data is not the hospital property. The data is exclusively the patient property. He has the right to revoke. He has the right to extend the amount of data he want to share. And this is part of the work that we are doing with Data Lake. And what we are saying is, yeah, we want to incentivize data sharing with a data sharing tool, in our tokenomics. But it's for the sake of humanity. It's not to give you like the appropriate advertisement. It's just for you and for the community, because there are people like they look like you. All people are not the same for sure, but they share some specific spine disease, and we can predict outcome from global data.
Yeah, I think, like you all are saying, the need for having patients be at the center of the care system is massive, and like no one is doing that. And so DAO is the perfect ecosystem in which to build this around the patient need and have them be an owner, a contributor, a developer of the solutions that are going to ultimately heal them. And I love that you all, the presentation, Vincent, you shared, showed you all like in a community of your own, kind of gathering together. It kind of follows that same ethos. I was hoping maybe you could talk a little bit about what you are looking for from community members. Like Virginie, you mentioned that there's a difference in the clinicians, the kind of academics. Basil, you mentioned there are patients that have data that they like to bring in. Talk about what you are looking for from the community and how you would like folks who are interested in SpineDAO to get involved, what they can bring to the table, what they can offer, and what the community of SpineDAO will grow into looking like.
Yeah, like data sharing is one of the engine of the DAO, but we need also to have a strong education program for patients, but also for practitioners, and that's why we need like a wide spectrum of skill and capabilities. Where, like, we want, for example, to produce some cartoon, and we are heavily discussing on that, how to explain science for adults, not for kids, for adults, but for different kind of cognitive. How can we share that? How can we modelize this kind of stuff? So yeah, we need like people like developer, but we also need like designer, like people that have skill in producing surgical videos, like hosting podcasts, and yeah, we need a wide range of skill and capability. So come join the Spine Club.
And beside like the skill, because that's kind of easy to think about the skill. Usually you have a product or a project in mind, and you're like, okay, I need this and this skill. Like, we also need to make sure that we keep the DAO open, like for the different shareholder, just to make sure like we don't necessarily go in the wrong direction, or not necessarily the wrong direction, but in a very narrow-minded direction. So we talk about like a clinician, we talk about researcher, we talk about like a patient. Maybe at one point we need to include like the payer. We need to include like the industry, because one of the big difference with creating a DAO is like it's not like us versus them, which is very like the case, at least in academic world. Like, you have the nice people that are doing academic, and like the dark side is industry, which make absolutely like no sense. So that's also like something we need to focus on, bringing like stakeholder that are different from whatever we're doing. And Marcel, that's what you started to do with some of your contact.
Yes. We're trying to be as inclusive as possible, and that's the concept behind the DAO to begin with. I wanna just bring up back the concept of including people. I think there's a huge sector that we are targeting, and we are receiving a lot of interest from, which is the student world, whether it's high school students, college students, medical students, just biomedical students, or engineers, or the inefficiency in science. And I'm going to use that to answer one of the questions that popped up from the audience. If you look at the training to create a surgeon or an engineer or a scientist, it's a long period of time. We have some subspecialties that you truly need about 16 to 20 years to generate a person to take care of, on average, maybe 1,000 patients a year. If you look at the data, and that's just not enough. Not enough. You look at the numbers. There's, sometimes there's one surgeon or one physician per 200,000 or 150 in some parts of the world. And why? Because, well, you need to spend the time to learn the materials and to learn the conditions and to see them. Well, what if we have a curriculum that actually make you see the conditions in all the diversity of it, in all the possibilities, but they're all mostly virtual throughout the day. It will make you see 30 types of one disease by putting a VR on you, or by walking into a room or something. You don't have to be physically in one place for 12 hours a day waiting for a disease to come to see it. I mean, it's think about it, it's very, very inefficient. So that's what we're trying to tackle, and we received a lot of interest. I mean, our inboxes are full of students from all over the world. How can I be part of this? How can I be part of this? It is exciting because it clearly have found a big problem, and trying to come up with, might sounds like a complex solution, but honestly, this is where the world is going, and it's going to become a really simple solution at some point, because everybody's just doing, DAOs and just doing blockchain.
Yeah, and also like finding new solution for the patient, not only a painkiller, injection, and surgery, is also our goal. I mean, we need some nutritionist. We need some coach that can enhance muscular system before and after surgery. We need like new eyes to open the discussion in terms of the spine therapeutics.
Yeah, and I see one of the comments like on the chat is like, should we team up with some of the publishing company like to accelerate like access to knowledge? So when you come to publishing to company, like it's almost like a scam. Like it's almost like a scam. Like you spend like a few years like putting together like a data set and a manuscript. Then you send that to a journal. You get a review that is all but constructive. Then eventually your paper is accepted. You need to pay it to make sure that your paper like is in open access. And then you need to pay to have access to your own paper because those papers are behind paywall. So we have like two initiatives like to address access to knowledge. The first one is what Vincent talked about, is like a Spine archive. So basically, we're going to create a repository of publication dedicated to spine. Right now, spine surgery, but we may extend. So this will be like modern publication. And in addition to that, we're starting like to set up some partnership to digitize like old knowledge. Knowledge from like 100 years ago that nobody has access to. So that will be like a hub where you can like query, you can have a chatbot to talk about basically talk about publication. So that's one effort. The other effort regarding like the publisher, like we want to create our own journal, our own decentralized journal. The nice thing is that the technology already exists. There is several players on the market, whether it's Research Hub, I think the other one is like Desai Lab. But we would like to do that a little bit in a slightly different way, in the sense that we want to make sure that whatever is being published in the Spine Journal will be dynamic, in the sense that maybe you publish a first draft, you get feedback from the community, you improve upon your draft. And now let's say that you have one more year of data for the same paper. You don't need to submit another paper. You can just update this one. So that would be like the dynamic nature. And I think it's also important like to be a little bit more modern. I know when you look at like publication is like a very boring PDF. What about like having access to similar content, but where you can interact with the data, where you can interact with the graph, where maybe you have some video, maybe some of the author, if they want to share some of the data in an anonymous way, well, they can also include the data so that somebody else can replicate the study or expand upon the study. And I mean, we can like expand to whatever we want. It can be like sharing algorithm, sharing code. So it's more like, let's go together and think about a story regarding to one research question. And of course, like make sure that this is open access. We don't want to end up replicating like the same issue that we currently have. So that's, instead of directly partnering with some of the publisher, we're going to take like a side route, and maybe at one point, like we're all going to live like an happy family and work again with the publisher. It's not like, the reality is like DAO are not, or decentralized science is not like we're going to fight traditional science. We're going to complement each other. And so everything that we talk about today will still happen in the traditional world. But at one point, I think we're going to meet.
Yeah, absolutely. And maybe it's our duty to go to the scientific society, because I know that you guys, Virginie Ambassador, are very involved in scientific society, and maybe it's the momentum now to say, hey, this is you have a new technology like Web3, like blockchain, immutability, transparency. Maybe SpineDAO could be a portal to onboard you in the Web3 and be part of the present and future of technology. And I think that usually you go and you invest in something that you know. So yeah, this is a call for scientific society and also a traditional journal to say, hey, SpineDAO can help you.
I think Nate has a question.
Yeah, I would just say, looking at the next sort of weeks and months, looking forward, we're going to see SpineDAO featured on the Bio Launchpad, looking like the end of this month, early next month. So I think that'll be a very exciting moment coming out to the world. What do you guys see as sort of the lowest hanging fruit for the DAO? Like what do you think you'll attack first? I know there's a number of different consumer-facing products you've spoken about, surgeon-facing products. In terms of focusing the DAO, what is your sense? And obviously, a lot of these efforts are pending DAO governance, but keen to hear your sort of intuition on what do you think you'll tackle first?
I can take it. So there's multiple solutions, as you mentioned, and the projects that we're going to propose to the governance. We're really excited to wait for that point where we can get the votes and get the decisions from the DAO. We did have a lot of background work on developing a lot of algorithms that are already tested on few thousand patients. As the maximum that we can do without a DAO, which is exactly the problem we spoke about. One of the very exciting projects that are very close to execution is the filter project. Basically, receiving spine patients' complaints and triaging them efficiently, and also as the patients being triaged or AI triaged, they will be educated about their disease, so they make an informed decision. So it's not going to be like, here we go, I have scoliosis, search, oh, Dr. Debo, pick him, go see him on Monday. It's going to be like, I have scoliosis, then we'll have a bot, basically the SpineDAO bot, that say, well, this is what scoliosis is, this is some x-rays, this is some exercise you could do, ensuring that there's red flags or not, and then eventually goes through our proprietary algorithm that will be able to give probabilities to the patients. Well, it's 80% likely that you are going to benefit from a non-surgical treatment. We recommend this list of physicians, and that will be through our upcoming partnerships that we're exploring with, whether it's healthcare systems or private practitioners or a huge group of caretakers. So I think that's the one that we're excited for, because it's close to getting executed. Virginie alluded to a lot of other projects we are also making a lot of strides on, but this one, I feel it will make almost an immediate impact the moment it hit the real life with patients versus practitioners. I don't know if Virginie has anything else to add about that.
No, I mean, I think you're right. Like, the right is like we cannot do everything at the same time. So we're focusing on like the one that will have like the immediate an immediate impact, and where we already have like a MPV. So.
And yeah, I think what's pretty novel here is, we'll see for the first time kind of an incentive model play out where if people want to enter their data, for instance, upload medical records or research data, the DAO can potentially incentivize them with a token that gives them governance rights, potential upside in the innovations that come out of the DAO. So I'm really excited. We're seeing a lot of DAOs sort of adopt, we're calling it like trials for tokens or data for tokens. And I think it sounds like, given the focus on patient data, having the Spine token used as that sort of incentive model will be pretty powerful there.
Yeah, and also you need to know that our aim is also the dream will be like to build some product that could be also be leased in part in Spine token, to have this circle economy. Like the token goes to the patient that give his data, we create the solution, and also the provider, for example, like a smart appointment software, can purchase or lease the solution in part in Spine token, and then it goes back to the data sharing pool. So yeah, and this is one of our goal, and I think that's the good path. The other path is to think about maybe secure the intellectual property, pledging the work group, saying like on this day, these guys, they work together and they did this product, and we secured it in an IP NFT. And I shoot out to Kevin Nosler from Molecule, because he's teaching me a lot on IP NFT. And then why not tokenize the intellectual property in order to incentivize like the early investor, but also all people that work on the project, and also patients, to have this circle economy that can benefit to all.
Yeah, and I'd like to comment on that. So if the DAO it just has no barriers, and it breaks the obstacles, not only from a scientific standpoint, but from financial standpoint. So if you think about it, I'm from the Middle East, and there's I look at it as like there's a candle lighting up in the Middle East every day. There are people that want to be part of the world, whether it's digital health, whether it's NFTs, whether it's decentralized science. I've met I have a lot of friends in Dubai, Saudi Arabia, Israel. There are people that want to be part of something big. And they are isolated off the ocean. I mean, if you think about an American solution, it'll never cross the ocean without a price. So what we're trying to do is to create the solution from the bottom up, and then own it. As Vincent mentioned, the DAO is almost the only possibility that a person from the Middle East and Africa and the US and Europe own together an IP that provides an excellent solution and incentivized. I mean, you just think about it. There's impossibility.
100%.
Doesn't work. So that's what the DAO is. It breaks barrier, it levels the field, but it presents the really nice picture of globalization that was probably misused a lot. I mean, you look at globalization, there's a lot of misuse of it. Kind of infringing your culture on other people, this or that, the other. But this way is bringing people together for the right way and ensuring really quality work that comes out of the DAO. So that's what I love about it. It has a lot of goods. I mean, we can talk about it for hours.
Yeah, it's empowering people, accelerating science, and building bridge at wide scale. It's thank you so much, bio people, for guide us, because we didn't know nothing about DAOs and stuff, and all the bio office are super useful to understand some insight on this.
Well, I think the other thing too is we're in the early stages of even understanding what the full potential here is, and I like reminding people of this because it's only through putting these structures into place, actually engaging with the scientists, engaging with the patients, seeing what the loops look like, and iterating from there, that we'll discover or work through the possibility space to get to what the ultimate design will be that will deliver the most benefit, the most care here. But from a fundamental first principles perspective, it all lines up, right? Make sure everyone is on the same place on the table, all contributing, that voices are heard. And Basel, like you're saying, that it's borderless. as opposed to being like, ah, yes, this is just an American institution as an example, and like, or vice versa, it's a foreign institution that is only available to folks in that specific area. And because spine issues are distributed evenly globally, it's not like, oh yes, this one country has all 15% of the patients who have spine issues. You have to have a global approach to a global problem.
Yeah, and we will be like one of the first clinical DAO with like long COVID labs, Curtopia to just put a path on this. And there will be some trap and there will be some obstacles, but I'm not afraid because the energy is here. And yeah, let's pioneer this. And maybe we could think about scaling up at all the musculoskeletal system if people want to join.
So we have a question from the audience that we can maybe tackle here. The patient is at the forefront of this project, but many may not be familiar with technology, let alone blockchain and DAOs, including surgeons, healthcare practitioners who may also be skeptical. How do you plan to overcome this challenge?
I think we have to.
Yeah, and I would say this is a challenge for everybody that is not familiar with Web3, and I would say like including myself. When you read, the more you read about it, like the more scary it is because you're like, I'm totally lost. So we need like to create some solution, or actually to use some existing solution. For example, from the patient side, as mentioned previously, like we have an agreement with Data Lake. So Data Lake is like not only like pretty good at bringing the patient on board from a consent form point of view, but also like recruiting the patient. So there is no way we're going to bring patient or even like provider by telling them like you need to have an address, a crypto address, and here is like the weird stuff that you have to do to share your data. So it needs to be up to one point kind of like transparent. And when we think about sharing data from a patient point of view, like right now we are a little bit stuck in the current way of doing it. We think about like, oh, the patient need to fill some questionnaire and maybe need to upload like their MRI, or maybe like, which may be a little bit challenging. But as we move forward, one of the objectives that we have is to shift a little bit what we are asking the patient, because not everything that we're asking right now is actually relevant. Most of the questions that we're asking is because that's the way we do academic research. They're not necessarily clinically relevant. What if we ask the patient just on a video, say like, just talk to us, talk to your practitioner, talk to your clinician and describe. There's so much information that you can get just from a video. So to get started, yes, we use like the old way of thinking about data, like the old like list of parameter, but I hope that pretty soon, like we will move away from that. And in any case, like we're gonna need some expertise to make sure we don't scare people away.
Yeah, I mean, I call this simplexity, kind of simplifying a complex problem. And that what it's going to come down to when you talk to an older patients that have a spine condition. And the solutions could be vast. I think Virginie was spot on. We need to empower current solution by the DAO, by our DAOs. And also, we're going to turn into a lot of solutions through AI agency. So it might be a bit of a frame on the wall that is an AI agent that the patient could talk to. And they ask him questions and they respond the usual way. And then they present things to them or they talk to them about their condition and their solution. So it could be, the communication doesn't have to be over a PC or a cell phone. AI agent world is so massive that you can create anything. You can create a small robot, eventually when we get to the point where we can reproduce it in a cheap format. I know, a lot of companies are working on that, but it will, the more we evolve, the more the world will evolve with us to enable us to deliver the message to older folks or folks that don't have the capability to actually access our solution. That we have that in mind every single day, because we deal with spine patients and we know what they can and cannot do. So yeah, that's a great question, but we do have a lot of ideas in mind.
And I think it's a challenge that also excites a lot of crypto native service providers too. Crypto folks are always looking, what is going to be the use case that brings the next billion users? Is it going to be NFTs, art, fun, like a fun game. You need to make things people want and need, and what do people want and need more than healthcare, especially if they have spine or neck issues or any other issues. So I think a lot of people in crypto will rally around these use cases and build the infrastructure that's needed to abstract things for patients, because there's a huge opportunity to onboard people into crypto, even if they don't realize they're interacting with crypto. For instance, go ahead.
I'm going to just give a positive story. It is better than anybody think. The elderly patients and the world is aging in general. I see 86 and 90 and 90 something years old in my office. And shout out to one of them, and I'm going to mention the name obviously for HIPAA, but she came to me. She's 86. She has a severe scoliosis with a little bit of kyphosis. She can't see forward. And I was talking to her, we got to check your conditions. We're going to make sure that you can tolerate any treatment we provide. We're going to start non-operative management. And she goes, Dr. Debo, I'm not done yet. I fly a plane. And she pulled up her phone and showed me. I can show it to you, but it had to be de-identified. She flies a plane, and her actually neighbor who was with her in the office said, "Oh yeah, we just landed like a couple days ago," and you would be surprised how functional the elder patients want to be, and if that means using Web3, they will use it. It's
100%.
It's
the same. It's the same in the countryside of Bordeaux. Like hunters, they use their smartphone. And yeah, let's think about Heal to Earn solution with connected object, Internet of Things. Like you can earn some spine if you achieve your milestone. That's endless. It's super fascinating.
One other thing that I think is important to understand is that right now, Web3 is in the process of becoming more and more easy to use. We're going through this user experience journey. Account abstraction is a really massive technology that we're planning on integrating here to just allow folks to simply log in with an email to access all of the Web3 functionality. And that Web3 functionality is really what powers the back end. But as was discussed here, a lot of the front end or the user experience for patients will look similar to any kind of non-crypto use case. And so we don't have to think about trying to jam crypto in every single place possible, but rather say, what are the fundamentals of blockchain that allow us to do this and build superior systems, but still making sure that we keep the fundamentals of user experience where they're good as possible, because we're optimizing for patient outcomes.
Yeah, that's your job, James. Make the Web3 easier. Make the Web3 easier so people can join the Spine Club.
I got you. No worries. I'll make sure the rest of the bio team gets on it as well. Nate, I think we got a couple minutes left. Is there anything you want to close us off with, or any last points?
Yeah, I think we're wrapping up at the top of the hour. But go ahead, guys. Why don't you guys?
Sorry, because I need to go back to the OR. Actually, I have a revision case. I get to put school in proper way. So I will be the first to say something. Big shout out to Guillaume and Joseph, the other member of the core team, and they're working with patients right now, and they're super important. Guillaume is working on filter very hard. Joseph allowed us to have Spine Tech London, so mille merci, thank you so much. And I wanted also to make a huge thanks to Scott, Aguda, Hamzat, all the team from Nigeria that are helping us so much to develop this project. Thank you to the Bio family. You are super useful, and I'm looking for the TGE. I don't know the TGE beginning of March. Can we spoil a little bit?
No.
You tell me. And thank you so much for all the guidance. Thank you so much.
No, of course. And as a summary, SpineDAO is obviously the premier DAO incubated here at Bio to work on delivering superior spine health and outcome for patients. If you all are interested in joining, I believe their website is up right now. You can also go to the Bio app page to learn more. And then we will keep you all tuned, as Vincent was sharing, for when we are going to have an opportunity for you all to participate in SpineDAO's first token launch. Stay tuned, and thank you so much, everyone, for participating. This has been amazing.
Thank you.
Thank you so much.
Thank you, guys.
Ciao.
Good luck with the